Michael, good morning. My first question is regarding reduced reimbursement for diagnostic imaging. This will force radiologists to read more cases to compensate for revenue losses. What is Siemens doing to help compensate or help physicians manage more data and be able to read more cases?
And basically what Siemens will do in order to make it easier for physicians to actually cope with the increased workload is that we will provide solutions that make it easier and faster and, let's say, help with automation in order to prepare cases, and then also help with automation in order to actually diagnose the results, report the results, and also come back to the results and find them again. And one of the big introductions that we have this year at the RSNA is Syngovia, which is a client-server-based reading environment that will allow actually throughout the hospital access to a lot of advanced applications that will help physicians to read much faster and, of course, anywhere in the healthcare system.
Michael, utilization rates for imaging modalities costing over $1 million. Will Siemens focus on developing diagnostic capabilities and systems that cost less than $1 million, or will it focus on systems that have broader applications to create greater utilization rates?
I think, Kristen, there are two answers to that question. Clearly, I think the $1 million mark will be a benchmark, and there are, let's say, offerings in our portfolio that will be positioned exactly in order to avoid that increase of utilization rate. Secondly, I think there is a productivity and efficiency aspect for equipment that will stay above that, where we basically have to say, if you have to increase the utilization rate up to 90%, you have to do more procedures on fewer pieces of equipment, and that will allow you to achieve the same economics as before. And the question is now, the third element is, will the 90% actually be enacted? Because if you look at both proposal and the healthcare legislation, nobody enacts the 90%. So this is now the big question, what will happen with healthcare reform and how will that impact the CMS proposal?
Michael, with the Healthcare Reform Act, possibly 94% of the U.S. population will be covered by healthcare, and won't this increase the patient population?
I think that's a very good question, Kristen. I think there will be some uptick in the procedure volume, but of course with all the other effects that we have seen with reduction in reimbursement rates through utilization rate increase, I think overall this will not have a net positive effect on our industry.
Final question, Michael. You were talking about diagnostic imaging, molecular tracers, and IT. What will be the big growth area for Siemens Healthcare in the United States in the next 5 years?
I mean, clearly healthcare IT is one of the big areas of growth. You see the support of the government behind the healthcare IT initiative. I think that definitely will drive demand, and I think that will also help to make the system more productive. But I also believe in a 5-year time horizon, also medical imaging will again grow, because I think we will see the benefits of imaging for the healthcare system, that it improves quality and actually reduces cost. And I think in 5 years we will definitely have that understanding.
Thank you very much, Michael.